Low-risk MDS represents a clinical scenario associated with unmet needs. As the first example, treating anemia, and in particular, restoring effective erythropoiesis in those patients after a failure of the treatment with ESA remains a global clinical need for this patient setting. So in terms of future need in terms of innovation, the definition of innovative treatment for anemia in low-risk MDS remains the most relevant area for drug developing in terms to improve quality of life of the patient and to improve the probability of survival of these patients.